one of these two exercises do you think is the best bladder control exercise for women who are seeking to overcome bladder leakage? Hi, I'm Michelle, and unfortunately neither of these two exercises will help you with your bladder control. The correct exercises to do are Kegel exercises for women. The exercises you've just seen will just strengthen the buttock muscles. They're great for strengthening the buttocks, the hips and the thighs. Today I'm going to guide you through everything you need to know, especially if you're a beginner starting out, to know how to do your bladder control exercises. Now these are specific exercises for stress incontinence, in other words leakage when you cough or when you sneeze, or also to urge incontinence, so when you have that really strong urge to go and you can't control it, like putting the key in the door. So what we're going to do is go through the two essential steps that you need to know for doing these exercises. I'm going to take you then through the best positions to do these exercises, and we'll talk about how many exercises you need to do to get the best possible results and overcome bladder leakage. So just to start with, so you know where your muscles are that you're exercising, they're not the outside muscles. So the muscles that you just saw before were for outside the pelvis. So this is the pelvis. This is outside the pelvis, and that's where those muscles are, the buttock muscles sit. So these are the sit bones that you sit on here. So the muscles that we need to exercise are the muscles that are in and around the bones where you sit, in here. They're at the base of the pelvis, which is why they're called the pelvic floor muscles. So if you actually look at the same muscles here, and you can see them on screen here as a close-up, they're these muscles that actually encircle the pelvic openings, the vagina, the urethra or the bladder opening, and also to the anus. So these are the muscles that we're going to be exercising. So they are internal, they can't be seen from the outside. So let's start. The first step is to know how to activate these muscles for your bladder control. The first step for women is to squeeze around the openings. So you're squeezing around all three openings at once, as if you're squeezing them closed like that, as if you're stopping passing gas and as if you're stopping the flow of urine. So that squeeze, that's the first part. See if you can squeeze now and then relax. Now, the second part, and this is a really important part for your bladder control, is to lift inwards. So after you've done the squeeze, or even if you can do it with the squeeze, lift the areas in and around those openings inwards and lift up inside, and then lower down slowly and relax. So two key steps you need to know: squeezing and lifting, and then very important that you relax back down to resting. They are the two key actions. If you're not sure how to feel or find and feel those pelvic floor muscles, you can refer to my video above, which teaches you some really good little tricks for feeling those muscles and actually identifying them and knowing that you're doing your pelvic floor exercises correctly. Now, to do those exercises for strengthening, here's what you do. You need to do two types of exercises: long exercises and short exercises. Now the long exercises are for your endurance muscles. So these are the muscles that will help you hold onto the bladder contents as the bladder expands, and the pelvic floor muscles will work as the bladder fills up. So we want these muscles to work for long periods of time, and that's how we need to train them. So what I'd like you to do now, if you can, is squeeze and lift inwards and try to count. So if you're sitting, sit yourself tall. If you're standing, if you're lying down with your knees bent, and then try to squeeze and then lift inwards, and you'd be counting for up to 10 seconds. So that's squeeze and lift inwards. Now see if you can do that. Squeeze and lift, squeeze and lift, squeeze and lift, and then relax down slowly if you can. Now don't worry if you can't feel the letting go. Sometimes this happens because the muscles are weak when you're a beginner. So often it takes a little bit of time before you can actually feel that squeezing and lifting and the letting go sensation. Now ideally you're aiming to do these holds, the long holds for your long endurance muscles, for up to 10 seconds at a time. And we try to aim to do 10 of these exercises in a row, having a rest in between each exercise, and trying to do those 3 times a day. Now, let's move on to your short exercises. These are really important for stopping leaks when you cough or when you sneeze. So we need the pelvic floor muscles to be able to contract really quickly, and that's why we're training them with these power exercises. So these are strong, powerful lift and squeeze, and this is a 1 second lift and lower, squeeze, lift and lower. Can you try 1 or 2 now where you are? Squeeze, lift inwards, and then lower down and relax. So again, we're aiming to do up to 10 of those in a row. And once again, you're trying to do those 3 times a day. So in total, you'd have your long exercises, your 3 lots of 10 long exercises, and your 3 lots of 10 short exercises. And it's best to spread those out throughout the day rather than trying to do them all in one go. So you might do 10 and then 10 and then 10. That's the best way of doing your exercises because it gives your pelvic floor muscles a chance to recover in between exercises. Now let's move on to the best positions for doing these. When you're a beginner starting out, and I'll get my little model here, it might be hard to contract these muscles. So what you might find is you need to start doing them lying down because gravity isn't working. When you're sitting or standing, you have to lift the muscles against gravity. So it means that the muscles have to work harder. Fantastic for strengthening in upright positions in sitting and standing, but it can be a little bit more challenging. So start in the position that you can best feel your pelvic floor muscles working. So it might be lying, it might be sitting upright away from the back of a chair, or it might be standing and doing your exercises in your standing positions. As I said, start with a position that you could feel your muscles working best in, but try to aim towards doing your exercises in those upright sitting and standing positions when you can, because they're the positions that you're most likely to experience bladder leakage. So they're the positions that you actually need to train the muscles to work in. So they're our key positions: lying down, sitting, and progressing to standing when you can. Now, really important part of your training is functional training, and I want to go through a couple of parts of this so that you actually can control bladder leaks and these bladder control exercises for leakage in real world situations. So let's say, for example, you're having problems with bladder leakage when you cough or when you sneeze. There's a technique called the knack, and it means to squeeze and lift inwards immediately before and during a cough. And you can try that now. So you might just feel a cough unbrace. So you do a little small cough and you can usually feel a bit of a pressure downwards, and that's that pressure from the diaphragm pressing down on your pelvic floor. This time, try to squeeze and lift inwards and do the same cough, and then you should feel less of a pressure down. So this is what you should do, the technique you should use before and during every time you cough, every time you sneeze. If you're experiencing bladder leakage when you're laughing, again, the same technique, but you've got to do it before that happens. If you're starting halfway through a cough, it's too late. The second key functional training thing or aspect of training that I want to go through is doing your exercises in standing, because as I mentioned, that's when you're going to have your leakage. So you might try, for example, doing a pelvic floor exercise or a Kegel exercise before you actually put the key in the door at home, if that's when you experience your bladder urgency. Or another good time to practice is before, when you turn the shower on, if you experience bladder urgency before or when the water's running. Put the water running and then try to contract your pelvic floor muscles with your squeeze and your lift before and during as getting into the shower, and see if you can control that urge. What you will find is the urge will eventually go or dissipate with the pelvic floor muscles on. So it's like an off switch. So when you contract your pelvic floor muscles, the bladder will actually relax, and then that will actually help you overcome your urgency. Now, you might need to do these exercises a number of times to get rid of that urgency, and it does take practice, and it's best to start when your bladder's not really full. It can be a bit more challenging when the bladder's really full. Now finally, let's go through some of the key mistakes to avoid with bladder control exercises. The first mistake is to squeeze your buttocks. We talked at the start of the video about buttock exercises. They're not the right exercises, and sometimes you can think you're doing your pelvic floor exercises when you're actually squeezing your buttocks. So your buttocks should remain relaxed throughout your Kegel exercises. The second mistake is to pull your tummy muscles, especially the upper tummy muscles, in hard when you do your Kegel exercises. These upper tummy muscles above your navel should stay relaxed. You might feel a gentle tension develop in the lower tummy muscles below your navel, and that's perfectly normal, but the upper ones should stay relaxed. The third mistake to avoid is to hold your breath. Try to breathe out as you start your Kegel exercises, and then resume normal breathing during your long hold. So try to breathe normally. You might have to breathe a little bit shallow at first, and that's okay. You will find you can normalize your breathing as your pelvic floor muscles become stronger as you practice your bladder control exercises. Now, the final mistake I wanted to mention is a really common mistake, and that is that some women tend to bear down or push down rather than lifting inwards. So really make sure that you're not bearing down with your Kegel exercises, because that will make your bladder control worse. The other important thing I wanted to mention is not constantly bracing your pelvic floor muscles. So this is a mistake that I think many of us have tended to make in the past, and holding the muscles on all the time. Have confidence in the fact that doing your regular exercises will strengthen and thicken the pelvic floor muscle support, so that they will work well for you when you are moving around. It's a mistake to constantly brace them all the time when you're walking or when you're exercising. Have confidence in the fact that those exercises that you will be doing will be strengthening your pelvic floor muscles, and that will give you better bladder control all around. So we've talked about quite a number of things there, haven't we? We've talked about the two key steps involved, the squeezing and the lifting. We've talked about the importance of doing long and short exercises for comprehensive training. We've also talked about the importance of doing your exercises, spreading them out during the course of the day and in different positions, aiming eventually for doing your exercises in standing. So these exercises can take up to 3 to 5 months to be really effective and really improve your bladder control. But some ladies actually find that even after a couple of weeks of practice, that their pelvic floor improves and their bladder leakage reduces. And you might expect that your bladder leakage reduces or stops altogether with these exercises. So I really hope that you've benefited from these exercises in this little tutorial today. If you found it helpful, I'd really appreciate it if you can give the video a like below, because then that helps encourage YouTube to share the video with other ladies that might benefit as well. I'd like to thank you very much for watching today. I look forward to seeing you next time. Goodbye for now.